ใจสตรองที่บึงยี่โถ
ทีมอสมบึงยี่โถพร้อมให้บริการอยากมีคุณภาพชีวิตที่ดีมาเป็นคนบึงยี่โถกันนะคะ
The Medical and Rehabilitation Center in the city, I feel like it's a primary facility that I've always dreamed of. I wish it could be available all over Thailand because it's something that's easily accessible and really meets the needs of the community.
I had a motorcycle accident and hit my head on the ground. At first I thought I wouldn't be able to walk again. After doing physical therapy here, I can go to school now.
The family has to take care of the bedridden patient, and we are getting great support from the Bun Ito municipality through the LTC system.
We come from home, right? In the first house, I lived alone, feeling lonely. But here, the staff are lovely, like siblings. It makes me happy. In the evening, I go home and relax, wrapping up the day. And then I'll start again tomorrow. But I'm really happy to be living at the Banpa Center. I truly mean this every time I say it. And I'm also glad that we're not wasting our lives and making them feel worthless.
In the past, we used to provide services reactively, but we found that the number of patients kept increasing. So we thought we needed to shift our service model to focus more on prevention and promotion rather than just treatment. At the same time, we still maintain the standards and quality of care so that people can receive the best services in their own communities. To reduce congestion from waiting in line at major hospitals, we have the idea of elevating services from health stations to primary care services with the highest potential.
Over the past 20 years, under the leadership of Mr. Rangsan Nanthakawong, Mayor of Bun Ito Municipality, Pathum Thani Province, the Mayor has a strong vision for development, emphasizing the elevation of service delivery standards to excellence, while consistently prioritizing the improvement of residents' quality of life. Bun Ito Municipality faces undeniable challenges, including a growing elderly population, increased loneliness, and a decline in community solidarity, common issues in urban areas. Therefore, it is essential for Bun Ito Municipality to proactively prepare for these challenges in order to effectively adapt to current and future changes.
If we look back 15 years ago, before Thailand had fully entered an aging society, I always thought that as a local authority working closely with the people, we needed to prepare and respond. Design services that would accommodate the increasing number of elderly people in the future. In addition, the public health system and community health services must respond to problems and facilitate people's lives, such as reducing wait times, lowering costs, making services more accessible, and being user-friendly, as well as providing convenient and fast transportation and communication. I work based on data under the name Bun Ito Smart Intelligence Center, or what we call the Intelligent Operations Center.
Currently, Bun Ito Municipality is recognized as a local organization with an effective health and social welfare management system, particularly in enhancing social services for the elderly through the STRONG model. This model consists of three core components: strong program, strong community, and strong innovation. The service program has been continuously designed and refined. In 2007, the municipality transitioned from the Bun Ito Sub-District Public Health Station to the Public Health Service Center No. 3, Wat Kien Khet. Later, it was renamed the Bun Ito Medical and Rehabilitation Center. Today, it is recognized as a leading health station for primary care service delivery. In 2014, the Elderly Quality of Life Development Center was established in Pha Rangsit Village. This initiative operates under the concept of the Elderly Quality of Life Development Center in the community, by the community, and for the community. In 2015, the Piyawararom Village Elderly Quality of Life Development Center opened, followed by the Satapon Village Elderly Quality of Life Development Center in 2016. These developments represent a significant and comprehensive expansion of services to the community, with the unique characteristics of being managed by a community committee. In 2017, the municipality launched a daycare center for the elderly, operating from morning until evening under the name Bun Yito Recreation and Rehabilitation Center. In 2019, a Memorandum of Understanding was signed among Bun Yito Municipality, Pathum Thani Province, Nogesaka Local, Japan, the Faculty of Social Administration at Thammasat University, Yukawara Municipality, and the Japan International Cooperation Agency, JICA. This agreement is part of the project on the development of local authorities for community-based integrated care through networking in Thailand and Japan, known as the Smart and Strong Project. Currently, over 30 local administrative organizations are involved in this initiative. In the same year, on February 13, the Bedside Caring and Loving Foundation was launched as a public sector initiative operated by the people. The establishment of this foundation addresses gaps and challenges in the municipality's procurement and donation of nursing equipment. In 2022, a coffee shop service designed to support families of dementia patients, known as the Dementia Cafe, was launched. The same year, a community shop named Strong opened, showcasing products and handicrafts made by the elderly and local residents. This shop serves as a source of pride for the people of Bun Yito, creating jobs and generating income while fostering happiness among the elderly in the community. The newest service program introduced in 2023 is the 60s Bar, a venue designed for the elderly. This initiative aims to address depression among elder adults by providing more opportunities for social activities and creating a gathering place for community members. All these initiatives have been recognized and awarded. The integrated services for the elderly under the Strong model received the ASEAN Elderly Innovation Award for Community Initiatives, the Healthy Aging Prize for ASEAN Innovation in 2021, and the Value of the Nation Award in 2024.
As a family medicine doctor working here, I feel extremely proud to be part of providing holistic healthcare for the community. In our role, we see each person as a human being. We don't just take care of their physical health, but we also address other aspects together as well.
I believe that the important thing is that we are no longer just working to react to or manage people's illnesses. We are striving to build a system of prevention, healthcare, and risk detection and management so that people can live longer and enjoy sustainable good health.
Even when it comes to dental health, I see it as a fundamental aspect of quality of life for people in the community. Having access to oral healthcare services, reducing and alleviating pain will help people have a better quality of life and be happier.
Comprehensive care, holistic care, integrated care, take care.
Bun Ito Smart Health City